Welcome to the Science Behind Kinesiology Taping, Session 2. So if you haven't watched Session 1, please do that before you come into this one, as they join together and will make more sense for you. So what we will cover in this online learning. So the focus of this learning is all about why we think kinesiology taping works. We're going to look at some of the science and also anecdotally what we see in our practices. So before we move on with new content, let's just have a quick recap from Session 1. So in Session 1, we covered the early claims of kinesiology taping that were untrue, which created controversy around kinesiology taping and why or why not it may work. Tape on its own won't make a huge difference, but as a part of a whole treatment plan can be very effective. But what it does do is it does create a new stimuli which stimulates those receptors within the tissues, those sensory nerve endings, to create a change or to create more feedback to the brain to create that change. So just a quick caveat, no one knows how kinesiology taping works exactly. No one knows 100%, and that includes the kinesiology taping manufacturers themselves, because there's actually been a little research into the fundamentals of how the tape actually works on the tissue and on the skin. So the information in this learning is based on the good research that is out there, because there is some good quality research and not so good quality research, and also anecdotally what we have seen in clinic as well. And the important thing is we understand why it may work, and it's all about the intention of what we're trying to achieve. And the combination of taping within the whole treatment plan and discussing your intention with your client so you're working on the same page can make a big impact on their treatment and recovery. Decompression. So when we talk about decompression, that's what we think may happen underneath the areas of the skin. So when the tape is applied, it can affect the areas underneath the skin. Now, the research in decompression, like most areas, is pretty inconclusive, and there has not been that much clinical evidence about this. But this is what we think may happen, especially when we see the changes that happen from bruising, swelling, and also lymphedema. So what decompression refers to is the elastic properties of the tape and how that can affect the skin. So when you apply the tape, what you may see is these little convolutions, the little waves on top of the skin. And you'll see it more commonly around areas such as the knee and other joints such as the elbow as well. And what we think happens by creating this convolution effect is it creates or may create a vertical lift off the skin from the underlying tissue, which creates a decompressed area. So the subcutaneous space between the skin and the muscle is therefore decompressed, which creates more space. So therefore, with the extra space, it may promote better blood flow and better lymphatic flow in and out of the area where tape is, which would help promote the healing. So there's better flow, then there can be increased healing to that area. And that's what we think may happen when we refer to decompression. Swelling and edema. So there has been some research about kinesiology taping to improve swelling and reduce swelling and edema. And this may happen because of the decompression element discussed just previously. So some of the studies have demonstrated that there has been swelling reduction, so lymphedema reduction post-mastectomy following breast cancer, reduction in swelling and pain from tendinobasitis of the pes anserinus, and also post-op anterior cruciate ligament reconstruction, so reducing swelling after that surgery. But there has also been studies that conflict this and whether kinesiology taping can reduce swelling after surgery. But anecdotally, both Pentony and I have seen this in our clinics, and we've seen swelling reduce and lymphedema reduce post-surgery and also post-injury. Increased muscle activation. So this increased muscle activation may be due to the new stimuli, so the novel stimuli on the tissue. And that stimuli creates that slight skin stretch, which then activates those Ruffini receptors, which then increases the sensory awareness and creates a new distraction to that area. But remember, it is global, so the tape applied is in the area of the muscle, but not directly on the muscle. So there's going to be activation of the Ruffini endings around the whole of the area, but there has been some research to say that there has been some muscle activation found from using kinesiology tape. This evidence is also conflicting as the others, as some studies have seen changes and some have not. There was a study by Gerson al. And they found that using kinesiology taping alongside physical therapy improved rectus abdominis muscle activation. So what they did, they used some physical therapy exercises for activation using things like anterior pelvic tilts, posterior pelvic tilts, and other exercises as well, alongside using kinesiology taping. And they did find there was a difference in those postnatal clients because they worked with postnatal clients. This was only a really small study. It was a pilot study. But from an anecdotal angle, both Pensley and I have seen increases in muscle strength and activation from using kinesiology tape inside our clinics. And that's where it falls a part of a whole treatment plan. So using kinesiology tape to activate certain areas of the body, to create more awareness, more stimulation, to build in strength. So we've seen that within using tape along activation exercises with clients, including those postnatal clients, so similarly to what they found in the study by Gerson. Next, we will look at offloading and support at joints. Offloading at joints is a really common type of kinesiology taping, and it's used by lots of physios and therapists to help with any joint issues. What we know about healing tissues after injury or surgery is that they need to be adequately loaded to stimulate that healing process. And what can happen if the client can't do that because they're in pain, they avoid that movement, which reduces the ability to stress that tissue to stimulate the healing process, which is where kinesiology tape may come in. So what kinesiology tape may do is it reduces the load of the joint. The tissue can still be loaded to stimulate the process, but at a slightly lesser extent until the patient feels ready to do so. So if they are in pain, and then kinesiology taping with the offload has reduced some pain, and it's allowed them then to create some movement to stimulate that process and load those tissues. And there was a small study found that kinesiology taping may improve the joint repositioning, offloading the tendons. The study measured the acromiohumeral distance before tape and then after tape was applied, and they measured the space after straight away. And what they found was that the space increased by quite a bit, which then may help reduce any rotator cuff tendon symptoms. Kinesiology tape may also be used to support joints, and there isn't that much research about this, but I've seen this anecdotally in practice. It's worked quite well. So kinesiology applied at a very heavy tension, so heavy tension with little recoil, will create some support and stability to a joint, creating a greater offload. But it still allows the ability to load the tissue and stimulate the healing process and repair. So at a lesser extent as some of the traditional types of taping, it still allows some load, but at a lesser extent. The next point looks into the science of how the tape is applied and whether there is any benefit of working with different types of application. So the question is, does the direction of the tape, the tension of the tape, the shape of the tape make a difference depending on what the intention is? Let's find out the answer. So a study by Lee al. Used different types of taping methods of application. So they tried different types of tensions of the tape. They tried with removing hair and leaving hair, different shapes of the tape, but they all had similar responses in terms of pain reduction for clients or patients with osteoarthritis. So the quote from the study is, "This may indicate that it is not the application that counts, but rather the effect that it can induce on patients." So what they suggested was any type of taping will make a difference for the client, and it's the effect that then that creates on the client, taking into account more of the psychosocial part of the biopsychosocial model. So this study suggests that the application of tape and any type of taping doesn't make that much of a difference, but it's the tape that made the difference, however it was applied. However, if your patient can perceive the different types of taping and methods of application that you're using, and you've discussed the intention of what you are trying to achieve together, will it have a greater effect on the client's healing process? Possibly. From working with tape with Pentony and I, we found that when we knew the tape was doing a certain thing, it felt different. So when we're offloading joints, that felt different, working towards the joint against working away from the joint. And it did make a big difference to how we perceived that intention of the taping. So taking that into consideration when you're working with your clients, that having that conversation, telling them what you're trying to achieve with using the tape and your other modalities, and that might have a greater effect on the treatment overall. But it is about the overall treatment and not just about sticking tape on a body part. And lastly, we'll discuss how kinesiology tape may enhance treatment time and recovery time. As we start to think about how kinesiology tape may be used with other modalities, so other types of techniques that you use, some studies have demonstrated that using the tape alongside physical therapy may improve symptoms a lot quicker than just with physical therapy alone. And if you go back to that study from Gerson, they suggested by using those activation techniques and the kinesiology tape made a bigger difference in rectus abdominis activation in their postnatal clients. A study by Kaya al. looked at kinesiology tape and physical therapy for a shoulder impingement. And what they found was that kinesio tape has been found to be more effective than the local modalities in the first week and was similarly effective at the second week of treatment, suggesting that kinesiology tape, or the use of kinesiology tape within the first week, was very effective in terms of pain management, but it was the same as using physical therapy within the second week of treatment. So what does this mean? So using kinesiology tape may reduce the patient's symptoms, allowing for a quicker uptake in an exercise program, which may then be avoided if the patient was in pain. So by desensitizing the area using kinesio tape and then adding exercise programming into the patient's plan may help them heal quicker, but also enhances the treatment time because they're going to be getting into those exercises a lot sooner than before. So in conclusion, we know now that kinesio tape isn't a modality on its own. It's not just a stick tape on and hope for the best. By focusing on the intention of what you're trying to achieve, that can have a great effect on the client's healing process, how they feel about the tape, and also their willingness to take part in exercise programming, which is going to stimulate the tissues to help that healing process further and reducing guarding from pain. But it all comes down to a whole area approach and a whole treatment plan approach. Alongside that, we do know that no one knows 100% whether kinesiology taping works or how it really works. But what we do know is we have seen some benefits in some of the studies that we've demonstrated in the last 2 sessions, but then also anecdotally in clinics as well. And it's about the whole treatment plan, integrating it into the areas that you need to. So once you've assessed your clients and you've released them, then it can help with the activation, or it can help with the desensitization in the release part of the treatment to help with the activation, because ultimately our goal is to get our clients moving, and taping is a part of that whole plan to get your clients moving and feeling well. And then lastly, we've got some of the references from the research, which you'll also find in the PDF download of this presentation.